Did you know the vast majority of medical decisions, we're talking something like a staggering 60 to 70%, they hinge entirely on laboratory test results?
Hmm.
I mean, that's mostly what doctors rely on, right? To figure out what's going on with you, to make an accurate diagnosis, and, well, to pick the best treatment. It's really the cornerstone of modern healthcare.
It absolutely is.
But what if I told you that the most crucial step, the one that's often overlooked, isn't some, complex analysis, but something way more fundamental?
Uh-huh.
Today, we're taking a deep dive into laboratory specimen collection. You've shared just a fantastic collection of sources with us, detailed guides, some cutting-edge research, and our mission today is really to extract those vital insights, those, aha moments that make you rethink the whole diagnostic journey.
And you've really hit on something profoundly important there. This initial phase, what we in the lab call the preanalytical phase, it's actually the most vulnerable part of the entire process.
Vulnerable, how so?
Well, it accounts for the majority of errors. It's not just about the incredibly sophisticated machines doing the analysis. It's fundamentally about the quality of what goes into them.
Ah, okay.
Think of it like baking, maybe.
Mm-hmm.
The best oven in the world, it just can't make a good cake if the ingredients are stale or, measured incorrectly.
Right, garbage in, garbage out, basically.
Exactly. And errors at this stage, they can have a real ripple effect. We're talking misdiagnoses, delayed treatments, and sometimes in the worst cases, actual patient harm.
That's a powerful analogy, and it really, really underscores the stakes involved. So over the next few minutes, we're going to explore why this seemingly simple step is so incredibly important. What exactly can go wrong? The surprisingly effective ways we prevent those errors, and even peek into the fascinating world of different sample types and how they're meticulously handled.
Sounds like a plan.
All right, let's unpack this critical first step. Why specimen quality is just paramount. It's almost counterintuitive, isn't it, to think that even the most precise, high-tech lab instruments, the ones designed to detect the tiniest anomalies, they can't compensate for a specimen that's already compromised before it even gets there.
It's true. Our sources really emphasize that. The quality of the analysis is entirely limited by the quality of the sample you submit.
It's like having that super fast car, but with flat tires, it's just not going to perform.
Precisely.
And what really jumps out from the research you shared is that in areas where things are highly standardized, like, say, breast cancer biopsies, where meticulous procedures are just rigorously followed, the rate of incorrect diagnosis can be incredibly low, sometimes just 2%. That really sets a benchmark, doesn't it, for what's possible when things are done right.
That 2% figure is, it's a testament to precision.
Yeah.
And it really highlights what we call the cascade effect of errors. If a sample is compromised right from the get-go, it doesn't just affect that one test. It's a chain reaction.
Right.
A false positive or a false negative result.
Yeah.
That can send a clinician down completely the wrong path.
Yeah.
Imagine someone getting delayed critical treatment because of a false negative.
Oh, wow.
Or, conversely, undergoing an unnecessary, maybe even invasive procedure because of a false positive.
And beyond the patient impact, which is huge.
Which is paramount, yes. But there's also a significant burden on healthcare economics, on safety, when a sample has to be recollected. Every repeat test isn't just about the money. It's more discomfort for the patient. It's more time, more resources diverted.
And it's not always obvious what can, throw a sample off. As we dug into these guides, it became clear that what goes wrong isn't always something dramatic. The sources highlight several really common collection and handling errors that frequently mean you need a repeat test. Like something as basic as improper tube filling, where the blood doesn't quite hit the right mark for the anticoagulant inside. That can completely invalidate results.
Absolutely. The blood-to-additive ratio is critical for many tests.
Or consider hemolysis. That's when red blood cells burst open, right?
You're right.
This can happen from, shaking the tube too vigorously, or alcohol contamination at the spot where they draw blood, or even extreme temperatures.
Yeah, all of those can cause it. And when those red cells burst, they release their contents, things like potassium, certain enzymes, right into the plasma or serum. That makes those specific test results completely unreliable.
Okay, so tube filling, hemolysis, what else?
Well, that ripple effect continues. Think about processing delays. Sometimes samples just sit around too long, and that can lead to the degradation of analytes. Those are the substances we're actually trying to measure.
So they break down.
They can, yes.
Yeah.
Or inadequate mixing of a tube. Sounds simple, but if it's not mixed properly, tiny clots can form, making the sample useless for hematology tests where we need to count individual cells.
Right.
even just drawing blood when a patient hasn't fasted. If fasting is required for that specific test, well, the results won't accurately reflect their baseline state.
That makes sense.
Then there's the whole issue of contamination, maybe from an IV line if the draw is too close, or using an insufficient volume of blood, or even just grabbing the wrong type of container for the test needed. It's really an intricate dance of many small, crucial steps.
So, if there are so many potential points of failure, what's the anchor? How do labs possibly ensure consistency?
That's a really crucial question. The solution relies heavily on two things: standardization and vigilance. And we achieve that through what we call standard operating procedures, or SOPs.
SOPs.
These aren't just bureaucratic hurdles, they're evidence-based protocols.
Yeah.
They're meticulously designed to minimize variability and ensure reliability across every single step. Think of them as the detailed recipe for every single test.
Okay.
And it's truly a shared responsibility, from the person collecting the sample right through to the technician processing it. Everyone plays a critical part.
Shared responsibility is definitely key, but it still sounds like a lot of places where things could potentially go wrong. From what you've seen in the sources, are these SOPs always easy to implement perfectly? Or are there, common human factor challenges that healthcare settings bump up against?
That's a very perceptive point. While SOPs provide the essential framework, yeah, human factors are always present. Things like fatigue, a really high workload, or even just feeling rushed. These can all lead to deviations from the protocol.
I can imagine.
That's precisely why training, regular competency assessments, and fostering a strong culture of safety are just as vital as the written procedures themselves. It's about empowering staff to identify and report issues without fear of blame, so problems can be addressed proactively before they impact a patient.
That makes perfect sense, building that safety culture. But okay, before any needle even touches skin or any sample cup is opened, the critical stage actually begins with you, the patient. Our sources reveal that your preparation, even before you step into the clinic, is just as vital as the collection itself. This really surprised me, just how much power the patient has over their own diagnostic accuracy.
It's absolutely true. And what really stands out from the material is how patient preparation ensures not just safety and an accurate diagnosis, but it also helps avoid interpretive mistakes by the doctor and prevents those frustrating, costly repeat tests we talked about.
Okay.
It's all about getting your body into a consistent baseline state so that the test results truly reflect what's happening internally without interference from, external factors like what you just ate.
And a huge part of that is food and drink, isn't it? We often hear about fasting, but do you really know why it's so important?
It's critical for certain tests.
Right. Fasting requirements are critical for tests like glucose and iron, usually meaning 8 to 12 hours without food. Sometimes even longer, maybe 12 to 14 hours, for lipid profiles, for cholesterol checks.
Usually plain water is permitted, though.
Yeah, usually plain water is okay, thank goodness. But specific foods can interfere directly. For instance, just eating before certain tests can lead to what's called postprandial lipemia, basically, fat circulating in your blood after a meal.
And that can cause problems.
Yeah, it not only alters inflammatory markers, but can even physically interfere with the optical test methods the lab machines use, making the sample appear cloudy or turbid.
And beyond that general effect, the sources reveal some truly surprising, very specific interactions. Can you imagine how certain colored foods, like carrots or yams, could potentially affect bilirubin readings?
Really? From carrots?
Potentially, yes. Or how specific amines these are compounds found in common foods like avocados, cheese, chocolate, even red wine need to be avoided before tests for catecholamines, which are stress hormones.
Wow.
The overarching insight here is just how incredibly specific the body's chemistry is, and how easily it can be skewed by seemingly innocuous dietary choices. It's not just about don't eat a huge burger. Sometimes it's about avoiding very particular compounds that can mimic or interfere with what the lab is trying to measure.
That's fascinating. And yeah, a little humbling to realize how much thought has to go into what we consume before a simple blood test.